Good morning and welcome to Radio Friends on Thursday, October the 17th. We're right in the middle of Breast Cancer Awareness Month. And I want to introduce you to Dr. Nicole Nelson, who is with us. Good to have you here, Doctor. And you were with Columbia Surgical Associates, which is an affiliate of MU Healthcare, correct?
That is correct.
And you have some important information for us about breast cancer awareness. Now, we were talking beforehand. We think of breast cancer as affecting only women, but you said there's a small percentage of men who also have to deal with breast cancer.
That's correct. Yeah. So there's about 1,200 new cases of breast cancer that will be diagnosed in men every year in this country as well.
How early should we be looking at breast cancer? What age group?
So different guidelines have different treatment recommendations. I'm a breast surgeon, and so I tend to follow the American Society of Breast Surgery recommendations. They recommend that the average risk woman should start screening at age 40. Other guidelines recommend 45 or 50. By starting screening at age 40, we can decrease the breast cancer-related mortality by about 39.6%.
Now, when you say screening, are you talking about self-examination, or are you talking about having a mammogram?
Mammograms. Yep. So mammograms should start somewhere between age 40 and age 50. By age 50, every woman should be getting mammograms.
How often?
So we recommend screening yearly.
But now, wasn't there some controversy on this a year or so ago, saying that maybe that was over-screening?
So different guidelines have different recommendations. Like I said, I'm a breast surgeon, so I tend to follow the breast surgery guidelines, which do recommend screening every year. There are other guidelines that say you can potentially do every other year. Again, we based our guidelines looking at life years gained, and by starting at age 40 and doing yearly, again, you maximize the amount of life years gained.
Okay. What about men? Do they have to do men have to do mammograms?
Men do not need to do mammograms.
So how would you detect breast cancer in a man?
So usually it's clinical exam. So if you feel a lump, so if as a man, if you are doing an exam, say you're in the shower washing things, and you notice that you feel a lump, you should contact your primary care physician and be evaluated.
Okay, so that's it for men. No mammogram for men.
No, the amount of breast tissue is a lot smaller in men, so it makes it a lot easier to feel if you were to have a clinical abnormality.
If you detect breast cancer in a woman, what do you do? What's the next step?
So the next step, first thing, again, screening is key. A mammogram is the only screening modality proven to decrease breast cancer-related mortality. If we can find these cancers when they're very early, the prognosis can be very good. So once we see that abnormality, or say someone comes in with a lump, we usually proceed with biopsy as the first thing. And then once those biopsy results come back, if they show a cancer, then we usually have the patient meet with a breast cancer surgeon to talk about kind of the stage, the prognosis, and then treatment recommendations.
A biopsy can come back negative also, right?
Biopsy can.
What do you do with the lump then if it's negative? Just let it go?
So we do have things that can cause a lump that are totally benign. So you can have benign tumors that can cause a lump.
Would you just let it stay there?
It depends on if it's bothering. If we're pretty convinced that, yes, the biopsy was adequate and correct, then depending on what the patient would like, if this is something that really bothers her, knowing that it's there, then sometimes we take it out if it doesn't really bother her, and we're comfortable with the accuracy of the biopsy, then sometimes we can just
let
observe.
It go. Okay, if the biopsy comes back that it is cancerous, is it always removed, or is that lump removed, or can it be treated with chemotherapy or with radiation without doing the surgery?
So at this point, the tumor is always removed. That may change in the future. Sometimes
is removed.
It is.
And then do you still do chemotherapy or radiation, or do you?
So it depends. It depends on the stage of the diagnosis. So if we our earlier breast cancers, there's a better chance that you could potentially avoid chemotherapy. If we can find the breast cancer when it's still a stage 1 or an early stage 2, there's a better chance that you could avoid potentially chemotherapy.
So obviously, every patient is different.
Absolutely.
There's no stock answer for it. But what the message she's getting across is that early detection is the key to survival.
It is.
And it's frightening. It's frightening to think about it. But so many advances have been made that now, just because you have breast cancer, it is not a death certificate anymore.
Not. No, and most of our patients actually do very well. For cancer, we like to quote 5-year survivals, and the 5-year survival for all comers with breast cancer is about 90%. So most people, 9 out of 10, are doing very, very well.
And also another key to survival is having a good mental attitude, isn't it?
That does help quite a bit.
You can tell that firsthand.
Yeah, there's a lot of things that we can do to help. So having a positive attitude, having good support. We've actually had a lot of studies in the last couple of years that looked at exercise, maintaining a healthy weight, eating healthy. All those things really do actually help improve your survival and decrease your incidence of developing breast cancer as well.
Mm-hmm. We're just about out of time, but how do you break the news to somebody that the biopsy came back and it is cancer?
So that's always tough. It's helpful when that lady has a lot of support, when she's got family or friends around that can help lessen that shock.
Yeah, but the important thing to do is always hold out that hope that it is going to be okay, and very good chance that it is going to be okay.
Right. And, you're going to have a whole team of people that are going to be working to give you the best possible outcome that we can.
Of course. Dr. Nicole Nelson, I want to thank you so much for coming by. You gave us a lot of good information. I think the important thing we leave today is make sure that you have your yearly exam with the mammogram, and always think positive, because that makes all the difference in the world. All right? It's a pleasure chatting with you. If you want more information, you can always go to muhealth.org, and you'll find everything that you need there. All right? We're out of time for today. If there's something that you would like to hear or see, I would love to hear from you. Simply drop me an email. That's pepperp@missouri.edu. Bye-bye.